The medical assistant may be asked to cleanse a patient's eye by irrigating it. An eye irrigation involves washing the eye with a flowing solution. It may be done to wash away foreign particles, ocular discharges, or harmful chemicals. Irrigation is also ordered to apply an antiseptic solution or relieve inflammation through the application of heat. Begin the procedure by sanitizing your hands. Assemble your equipment. If both eyes are to be irrigated, 2 sets of equipment must be used to prevent cross-infection from one eye to the other. You will need disposable non-powdered gloves, the irrigating solution, a solution container, a disposable rubber bulb syringe, a basin, a moisture-resistant towel, and sterile gauze pads. You will need to check the solution label 3 times to make sure you have the correct solution. The first time is after you remove the solution container from the shelf. Compare the label on the solution container with the physician's instructions to make sure you have selected the correct solution as ordered by the physician. Normal saline, also known as sodium chloride, is generally used to irrigate the eye. Check the expiration date of the solution. If it is outdated, discard the solution, as it may produce undesirable effects and should be discarded. Warm the solution to body temperature, or about 98.6 degrees Fahrenheit. This is done by placing the solution container in a basin of warm water. Use a bath thermometer to make sure the water used to warm the solution does not exceed body temperature. A solution that is too hot or too cold can be uncomfortable for the patient. Now, check the solution label a second time before pouring the solution. Palm the label of the container to prevent the solution from dripping on the label and obscuring it or loosening the label. Remove the cap of the container by touching only the outside of the cap and placing it on a flat surface with the open end up. This prevents contamination of the cap. Rinse the lip of the bottle by pouring a small amount of solution into a separate container. Pour the solution into the basin at a height of approximately 6 inches to reduce splashing. Replace the cap on the container without contaminating it, and check the label a 3rd time before you return the container to its storage location. These multiple checks let you discover any mistake you may have made in choosing the correct solution.
Hello, Leah.
Greet the patient
Hi, how
and
are you?
introduce
Good.
yourself.
And my name is Vicky. I'm a medical assistant for Dr. Murphy.
Identify the patient and explain what you plan to do.
Okay, wonderful. The doctor would like for me to irrigate your left eye for you. He said that you were having some discharge coming from it.
If the patient wears glasses or contact lenses, ask her to remove them. Position the patient so that she is lying down or sitting. The procedure is more comfortable for the patient if she is lying down. Place a moisture-resistant towel on the patient's shoulder to protect her clothing. Position a basin tightly against her cheek, under the affected eye, to catch the irrigation solution. Ask her to tilt her head to the side in the direction of the affected eye. This position encourages the solution to flow away from the unaffected eye to prevent cross-infection. Ask the patient to hold the basin in place. Apply non-powdered gloves. Powder on the outside of a powdered glove could get into a patient's eye and irritate it, so choose non-powdered gloves. You must first cleanse the eyelids to remove any discharge or debris on the lids. This prevents foreign particles from entering the eye during the irrigation. Cleanse the eyelids from the inner to the outer canthus. The inner canthus is the inner junction of the eyelids next to the nose. The outer canthus is the junction of the eyelids farthest from the nose. Cleansing from inner to outer canthus prevents cross-infection. Use a gauze pad moistened with normal saline or the solution ordered for irrigation. Discard the gauze pad after each wipe. Fill the irrigating syringe by squeezing the bulb and slowly releasing it until the desired amount of solution enters the bulb. Instruct the patient to keep both eyes open during the procedure and look at a focal point. Looking at a focal point helps the patient keep the irrigated eye open during the procedure. With the non-dominant hand, separate the eyelids with the index finger and thumb to expose the lower conjunctiva and to hold the upper eyelid open. The patient will have a tendency to close the eye during the irrigation if you don't hold it open. With the dominant hand, hold the syringe about 1 inch above the eye at the inner canthus. Gently release the solution onto the eye at the inner canthus. Direct the solution toward the lower conjunctiva. It is important not to direct the solution at the cornea because the cornea is sensitive and can be harmed easily. Using this technique allows the solution to flow over the eye at a moderate rate from the inner to the outer canthus. The solution flows away from the unaffected eye, which prevents cross-infection. Do not allow the tip of the syringe to touch the eye, as this can cause an injury. Refill the syringe and continue irrigating until the desired results have been obtained or all the solution is used, depending on the purpose of the irrigation. The physician has ordered sterile saline to remove discharge from the patient's left eye. Dry the eyelids with a gauze pad from the inner to the outer canthus. Remove your gloves and sanitize your hands. Chart the procedure. Include the date and time, which eye was irrigated, the type, strength, and amount of solution used, and any significant observations and patient reactions. Use the appropriate abbreviation. Both eyes is OU, the right eye is OD, and the left eye is OS.